This is Fox 5 Morning News.
Medical professionals, caregivers, and patients are taking to Capitol Hill this morning to ask lawmakers to get a grip on health care reform. The nonprofit Community Oncology Alliance says there won't be any real progress unless Congress manages to cut through a snarl of competing ideas on coverage, payment options, and reimbursement plans. Joining us now is the Alliance's Executive Director, Ted Okon, with a preview of the message that he will be taking to the Hill today. Ted, good morning.
Good morning, Allison.
Well, this is an odd group. We don't normally see this group going up to Capitol Hill to lobby for change, but what message today?
Well, the message today is we're facing we have the best cancer care in the world, in this country. But the problem is we're in a real crisis situation because patients are having a tough time paying for cancer care, and the providers of care are having a tough time delivering that. And unfortunately, exacerbating that is the fact that we're actually running out of oncologists relative to demand. So in this healthcare debate, the president has done a good job of saying we need to take in this country and we need to build on what works and we need to fix what is broken. Well, our message today is, Mr. President, we need to build on the excellent delivery of cancer care that we've developed in this country. But what we also have to do is we have to fix what's broken. And one of the things that's broken is the Medicare program when it comes to paying for cancer care.
The healthcare reform plan overall, I think a lot of Americans maybe just sort of, it's so big, I can't understand what this actually means. Could you break it down? How far does this plan go, and what exactly would you hope to see gained by your effort today?
Well, I think that in general, what healthcare reform is what we're talking about is the fact that we have about 46 to 48 million Americans that are uninsured. That's simply unacceptable. And when you talk about a disease such as cancer care, every American, especially in this country, which is filled with unbounded opportunity, should have access to quality, affordable cancer care and health care in general. So I think one of the debates that we're looking at is how do we find a way of making sure that those Americans who are uninsured or underinsured have access to quality health care, whether it be cancer care, cardiovascular disease, diabetes, whatever. And that's part of the big debate. And that obviously costs a lot of money. So that's where we find the debate up on the Hill to exactly how to pay for that.
And I think the fear with those of us who are fortunate enough to be insured and still employed, we say, hey, well, am I going to have to foot the bill? We're hearing a lot of these buzzwords now out there, you know, socialism and government-run health care.
Right.
Put those to rest if you can, as far as what we will have to pay the insured, and will we really see a big difference in our health care premium?
Well, I think that one of the things that that we're not focused enough on is actually we're talking about health care, but it's more about disease care. We have to focus some more of our dollars, I think, on prevention. We can actually prevent a third of all cancers through diet, through stopping smoking and things like that. So I think that we have to also realize that this is not just about disease care, but it should be about health care in terms of education and prevention. But I think the big thing that we have to realize is we see with this financial crisis that health care has really cost this country. We've seen it with cancer care. We have a third of patients that, a third of Americans out there say that if their cancer care were too expensive, they would forego treatment. So I think in order for this country to really deal with this crisis, we have to make an investment, but we have to make an intelligent investment, and that's part of our message today.
And very interesting, I'm glad that you've come here before your stop on Capitol Hill, because it puts a real, like, one disease, a terrible, devastating disease, cancer, that's just one of the elements that perhaps a lot of people haven't thought. If you don't go to the doctor regularly, you know, because you're not insured, when something big like this comes, where do you go? And
Allison, we've been talking for, what, 3 minutes now? And I hate to tell you that in those 3 minutes, on average, 3 Americans have died of cancer. Every minute in this country, on average, an American dies of cancer. So we've done a great job of treating the disease, but we still have 500,000 Americans that die each year of cancer. And part of our message today is going to be, please help a system that is broken. Help us basically fix the system, especially when it comes to Medicare.
Ted Okon, healthcare expert and executive director of the Community Oncology Alliance. Thank you.
Thank you, Allison.